Asthma is the most common chronic condition in children, and the symptoms are usually noticeable before age 5. There is no cure, but it can be treated and managed. The main symptoms are cough, usually dry, wheezing, chest tightness, and/or difficulty breathing, particularly during expiration. It is more common in males than females under the age of 15. Asthma has 4 main components: bronchospasm, inflammation, edema with mucus, and airway hyperactivity. The small airways constrict when triggered. The etiology is largely unknown, but asthma can be caused if one or both parents suffer from asthma, if the child suffers from respiratory allergies, premature birth, or lung infections. All of these increase the chance of developing asthma. Asthma can be classified as mild, moderate, and severe depending on the number of exacerbations experienced. It is hard for the child to breathe out because of the constriction of the airway. Air is trapped and causes the lung to hyperinflate. Some of the triggers are tobacco smoke, air pollution, house dust, animal dander, wool, feathers, pollen, mold, strong odors, physical activity and stress, and viral infections.
Beta-2 agonist bronchodilators work by targeting the beta-2 receptors in the smooth muscle of the airway, initiating a parasympathetic response and allowing the bronchi to dilate. Bronchodilators can be either long-acting for maintenance therapy or short-acting for acute bronchospasms. Glucocorticoids bind to the cytosolic steroid receptor, transcribing information to the nucleus. It prevents asthma attacks by reducing inflammation as well as reducing sputum production. It's common to inhale a bronchodilator and then a glucocorticoid. Together, long-acting bronchodilators and glucocorticoids work not only faster, but the duration of action is longer and less of.
A person diagnosed with asthma is at risk for many potential issues as a result of the progression of their disease. This may include ineffective tissue perfusion, ineffective airway clearance, a low O2 saturation, the possibility of atelectasis, which is collapsed lungs, short of breath on exertion, an asthma exacerbation or asthma attack, pneumonia, ineffective family coping, and anxiety related to the fear of not being able to breathe properly.
Just trying to reduce that bit of stress and anxiety, which will, in turn, make the asthma attack worse.
No lab test can diagnose asthma, but they are important to predict and determine the severity of asthma and to rule out other health issues. Young children with food and respiratory allergies are more likely to have asthma. Plus, respiratory allergies may present similarly to asthma. Thus, immunoglobulin E tests are commonly performed on those with suspected or diagnosed asthma. While asthma will not be displayed through radiographic imaging, X-rays can show peribronchial thickening and hyperinflation. X-rays are routinely done to rule out other illnesses, such as pneumonia and cystic fibrosis.
Exercise can be a really, really great tool in controlling your asthmatic attacks. Exercise just helps decrease the inflammation in your airways and helps improve your lung capacity. A lot of our patients might be a little skeptical of exercise plans, but we just need to make sure that we can create an exercise plan depending on what they were able to do pre-diagnoses. Even just keeping the exercise really, really moderate, like things like yoga, can help reduce the stress and anxiety in that patient, which can in turn reduce the amount of triggers they're experiencing, and it will also help open those airways and get them to deep breathe. So even something just as simple as yoga is really good. But if we do have patients that are more willing to go and do some more vigorous exercise, just making sure that they have their inhalers or oral medications with them that they can take before and after exercising, just to make sure that those airways are nice and clear. We also want to talk to them about smoking cessation if this is an issue with our clients, as well as the flu shot. I really want to recommend that they get the flu shot, as this helps reduce the frequency of asthma attacks that they're experiencing, because upper respiratory tract infections and viral respiratory tract infections can both increase the amount of episodes you experience and make you more sensitive to the triggers that already exist. We can also promote some self-management education, so just making sure that they know how to use their inhalers, their medications, what they're on, what they're for, what they do. I'm going to be talking more about client teaching a little later in the PowerPoint, but just making sure that we're really empowering them with self-management, because a lot of management in asthma is self-directed management. And if this patient would like, we can create an action plan for them, which is just a really clear pathway of care for them to follow when they need. It's also really important for them to know their own triggers so that they can start avoiding those triggers and limiting those triggers in their own house. So again, those triggers can just be stress, anxiety, exercise, dust, pets, dampness. So just making sure that they know their own triggers and are avoiding those, and we can provide them with any other resources that they may need.
If the child's asthma is not well controlled, then a referral to the pulmonologist or allergist might be necessary. A referral to a social worker might be needed in financing the medication or equipment, such as a nebulizer or spacer, is needed. Or if housing is inadequate, adding to the environmental triggers, such as mold, smoke, dirt, or animal dander. A pharmacist could be helpful in reviewing the medication of the child with the parents and ensuring that there are no drug-to-drug interactions. A referral to public health nurse for immunizations. Pediatrician could be consulted if other comorbidities are involved. The family doctor would be key in making the referral and in monitoring the child.
The majority of care and management for asthmatic patients will be occurring in their home as self-care management, and that will be without a care provider, so it's important that we provide them with all the information they need before they leave our facility. The first step in client teaching is teaching them how to properly use their inhalers or nebulizers if that's something they're going to be using at home, how to read those directions that their prescriber or their doctor has written to them, and how to properly administer those medications. I also want to teach them about some of the side effects they may experience from these. Some of the side effects I want to educate them on would be vertigo or dizziness after the use of some of these inhalers or nebulizers. I want to teach them how to properly perform mouth care after using a corticosteroid inhaler, as using a corticosteroid inhaler and not performing mouth care can create a really uncomfortable infection called thrush in their mouth. I also want to teach them about nasal inhalers and oxygen therapy through nasal prongs and how that might irritate their nasal passageways. So just letting them know to have a humidifier on hand at home to help limit the irritation that they may be feeling. It's important that these clients have their inhalers on them at all times, just in case they experience an asthmatic attack, they can be prepared for it. It's also crucial to let them know not to take any more puffs than prescribed and to contact their doctor if their medication is not working for them. Giving them some brief overview of the medication that they're using and what that's doing to their body can help them notice any side effects or any concerns that they may have that they can bring up with their doctor later on in another visit. Teaching these clients techniques like pursed-lipped breathing can be super helpful in controlling their breathing. Pursed-lipped breathing helps with the onset of asthma attacks or shortness of breath. It can help them control their breathing and make each breath more effective in terms of oxygen perfusion in their body. Discussing light exercise with this client can also be really helpful, and just explaining to them how this affects their body and how this helps limit the amount of exacerbations that they may be experiencing, how it helps open their airways, limit their stress and anxiety, and help build their lung capacity. I understand that asthma can be triggered by vigorous exercise, so just teaching them about some light exercises, depending on what they were able to do before their diagnoses, is really important with these clients. With the diagnoses of ineffective airway clearance, the assessments will include auscultating the lungs, assessing for shortness of breath or shortness of breath on exertion, medication use and use of inhaler, assessing the airway, vital signs, assessing their hydration status, and assessing the patient's pain levels.
Planning goals for ineffective airway clearance would be maintaining a clear and open airway with normal breathing sounds and an oxygen saturation above 92%. The child will be able to demonstrate pursed-lip breathing and an effective secretion removal. The child will avoid known triggers. The nurse will review the signs and symptoms of respiratory infection, and the child will go over where and when and whom to call for help. The parents of the child will recognize signs and symptoms of exacerbation and will deal with them promptly, avoiding unnecessary emergency visits. The child can demonstrate the proper use of a spacer and the sequence of puffers and how often and when to use. The child will be able to maintain a near normal activity level.
Instruct the patient to breathe deeply and cough 4 to 5 times every 2 hours because retained secretions increase the risk for infections. Increase fluid intake to at least 1,000 milliliters per day because fluids help dilute pulmonary secretions, which promotes the removal of the secretions. Teach pursed-lip breathing techniques to the patient because pursed-lip breathing technique slows breathing and allows for adequate gas exchange.
Different cultures perceive health and disease differently, and these perceptions can influence the interpretation of medical knowledge, prior experience with Western medicine, and perhaps the disease itself. It also can affect the lens in which the family chooses to address the asthma. In Canada, we have many cultures and have many remote communities. It is necessary that the nurse be aware of the special needs that could be present and be curious and open to exploring the unique needs and challenges of each family. Social isolation and other social determinants of health in some of the more remote communities could be extremely challenging with asthma. Using telehealth and being aware of all local community supports would be vital to plan client-centered care and to ensure the family and child have continuous support.
Asthma itself isn't cured, only managed. Traditional healing is no different. While many or some indigenous bands may use the plants listed, traditional indigenous healing uses what the land has to offer and has varying ceremonies and practices when using the plants. Canada has a wide variety of biomes and hundreds of different indigenous cultures. All are unique. Balsam fir, used in tea of bark or branches, treats cough and spiritual distress. It can be made into an incense and used to treat other lung problems. The root of the American sweet flag is used for coughs, sore throats, and other lung ailments. The bark of the alder tree is used for coughs, and infusion of juniper is used for cough, lung disease, and is burned to protect against evil and illness. Sage is also used for respiratory ailment and spiritual protection and cleansing.